Hello, I'm registered nurse Jeffrey Collins. I would like again to thank you for your participation in this educational research project. The goal of this project is to determine the role of education in reducing workplace injuries for healthcare providers. As many of you know, the healthcare industry continues to be plagued by a disproportionate number of injuries for the work that we do. These injuries have an enormous cost, both monetary, quality of life, and ultimately they diminish patient care. This research project is being completed to fulfill the research requirement for the Master's of Science in Nursing degree at William Carey University. Our objectives for today are to define the key terms associated with injury prevention, differentiate between musculoskeletal injuries, impact injuries, and pathogen exposure injuries. Identify the leading causes of workplace injuries for hospital personnel. Use mitigation techniques to increase workplace safety. Describe procedure for reporting workplace safety hazards, and identify federal agencies responsible for workplace safety. Again, I thank you for attending this online educational research project. If you have any questions during this project, please feel free to contact me by email at the email address provided. So at this point, you're probably curious as to why I selected injury prevention as the topic of my educational research project. Quite honestly, I was fascinated to learn that injuries to workers in the healthcare industry outpace those of all other industries. These injuries have far-reaching implications both to the employee, the employer, and ultimately they degrade our patient care. Not only are injuries to healthcare workers the #1 reported workplace injury in the country, these injuries cost healthcare employers over $2 billion per year. These injuries can be immediately life-threatening. They can also have long-term implications. Workplace injury is a leading cause of disability claims for healthcare workers, and ultimately these injuries take time away from our patients. The following charts provided by the Bureau of Labor Statistics contrast the healthcare industry with other major industries in the United States. Here we see the 2013 Bureau of Labor Statistics data, which indicates the healthcare and social assistance industries reported over 600,000 injuries and illnesses reported from work-related causes. In our next slide, we'll see that the Bureau of Labor Statistics reported in 2013 there were 8 industry sectors that reported in excess of 100,000 workplace injuries and illness. You will notice that 3 of the 8 sectors highlighted, general, medical, and surgical hospitals, nursing and residential care facilities, and ambulatory healthcare services, are all part of the larger healthcare industry. In this slide, we'll see the injury rates as broken down by the individual healthcare disciplines. These statistics show nurse aides, EMS workers, and occupational therapy assistants had the highest rate of reported injuries. We will see later in the program that patient transfer and movement is the #1 cause of injury to healthcare providers. This would correlate directly with the duties of nurse aides, EMS workers, and occupational therapy assistants and aides. It's hard to believe, but according to government data sources, the healthcare industry is far more dangerous than construction zones and even factories. A lot of these injuries result in lost work time. This lost work time creates staffing shortages, and these staffing shortages ultimately result in a decline in patient care. So in reviewing the government data, the healthcare industry outpaces all other industries in the number of reported workplace injuries. Within the healthcare industry, nursing aides, attendants, and technicians have the highest incidence of reported workplace injuries. They're followed closely behind by EMS workers. This is likely due to the fact that most injuries are reported during patient movement and transfer. When discussing workplace injuries for healthcare providers, It's best to categorize those injuries by the type of injuries that the workers report. For the purpose of today's discussion, we will cluster workplace injuries into three main categories. Those are musculoskeletal injuries, impact injuries, and pathogen exposure injuries. First, we will look at musculoskeletal injuries, which include sprains, strains, and overuse or repetitive use injuries. These injuries usually occur during patient transfer, movement, and lifting. Low back injuries are the most commonly reported injury. These often lead to long-term debilitating issues. Low back pain is the leading cause of disability claims for healthcare providers. This can be addressed through educational programs and mitigation techniques. According to the Bureau of Labor Statistics, musculoskeletal injuries account for far more than half of all reported workplace injuries for healthcare providers. The next category of injuries that we'll discuss are impact injuries. Impact injuries are caused by direct contact with other items. These include slips, trips, and falls, striking fixed objects such as mounted monitors or doorways, includes tripping over cables, cords, and hoses. Ironically, often our focus on a patient leads to these injuries by reducing our situational awareness. These are the leading cause of bone and joint and other orthopedic injuries. And again, these can be addressed with educational interventions. The last category of injuries that we will discuss today are pathogen exposure injuries. Pathogen exposure injuries include sharps and needle stick injuries, contact between body fluids and mucosa, and open wounds. Unfortunately, these often have delayed effects, and it can be months, years, or even decades before the true consequence of these injuries is known. Although transmission of HIV and AIDS is a great concern for healthcare providers, research shows you're 100 times more likely to contract hepatitis through needle stick and body fluid transfer. Numerous laws and regulations address pathogen exposure injuries. Unfortunately, a great number of these injuries result from shortcuts in an effort to save time. This can prove fatal depending upon diseases contracted. Again, these can be mitigated and addressed with educational programs. So the question before us today is, how do we reduce workplace injuries for healthcare providers? We do that through the concept of safety culture. A safety culture is required to achieve reduction in workplace injuries. We all understand that regulation starts at the top, but culture starts from the bottom. I can't overemphasize the role that peer pressure, both positive and negative, play in reducing workplace injuries. It can be positive when we say to one another, "No, stop, let's get the appropriate lift equipment before we transfer this patient." Or we can say, let's make sure that we don the appropriate protective equipment before we go into this room of this patient who has a communicable disease. And it can also work in the negative when we say, oh, we don't have time to go get the appropriate equipment. Let's just transfer him over. We've done it that way for years. Through the use of positive peer pressure, we can reduce staffing shortages and increase productivity on our units. We all play a part in the concept of safety culture. As professionals, we have to look out not only for ourselves, but also for our coworkers and teammates. Without their assistance, we could not provide effective patient care. Next, I would like to discuss mitigation. Mitigation are techniques utilized to reduce the frequency or severity of workplace injuries. These can be engineered safety practices, which are changes to the actual equipment that we use, such as shielded needles, hydraulic lifts, and similar equipment. They can also be procedural or regulatory changes. Regardless of the mitigation technique employed, all involve employee participation. Now let's look at ways to reduce musculoskeletal injuries, which I'll remind you are the most common injuries reported by healthcare workers. Keys to reducing musculoskeletal injuries include proper lift training. You should be familiar with the equipment and techniques used at your facility. Always have appropriate manpower available to do patient transfer. Never attempt to transfer a patient alone. You should maintain good physical fitness, as a fit body is much less likely to receive musculoskeletal injuries. You should always practice good body mechanics, include bending your knees when you do lift. And lastly, you should always utilize the appropriate lifting equipment such as Hoya or overhead lifts as available by your facility. Now let's focus on reducing impact type injuries. Impact injuries are those injuries that involve contact between a person and a fixed object and include slips, trips, and falls. We can reduce these impact injuries by removing unneeded equipment from patient care areas. We can raise fixed monitors above head height if possible. We can note pinch points of beds and wheelchairs, especially since some of these can produce scissor forces capable of amputating fingers. It's also important that we route cords, wires, hoses, and cables outside of the high traffic areas. Our last category of mitigation techniques to explore is pathogen exposure injuries. All healthcare facilities are now required by the Occupational Safety and Health Administration to provide bloodborne pathogen training to all employees and clinical personnel. Never recap used needles, and never use needles to transfer blood or body fluids, especially between syringes and vacuum blood collection tubes such as vacutainers. Most needle stick type injuries occur when giving intramuscular or IM injections. We should always use engineered safety needles. Make sure when you activate the safety cap on these engineered needles that you do so with one hand, never two-handed. If needed, you can use a fixed hard object such as a countertop to activate these safeties. Always use appropriate personal protective equipment, including gloves, gowns, face masks, goggles, or face shields as appropriate. As the old adage goes, if it's wet and warm and not yours, don't touch it. You should be familiar with your facility's policies and procedures for reporting unsafe working conditions. Ultimately, the government agency tasked with overseeing workplace safety is the Occupational Safety and Health Administration. However, prior to contacting OSHA for any regulation, you should always give your employer ample opportunity to mitigate the workplace violation. In summarizing today's educational offering, workplace injuries are a major concern in the healthcare industry. We have three categories of injuries: musculoskeletal, impact, and exposure type injuries. Reducing workplace injuries will involve a culture of change. We must look out for one another. Using proper techniques and mitigation factors can reduce workplace injuries. This completes the educational offering. I hope that you've gained some knowledge that will be useful in your practice. I would like to once again thank you for taking the time and effort to participate in this educational research project. At this time, I would ask that you complete the post-test and the course evaluation and submit those online. If you have any questions, please feel free to contact me by email. Thank you.